Well, good job to the class for doing so well on your muscle exam. Good job. 10 A's, that's really huge. Good work. Moving on, over spring break, I encourage you to watch the YouTube videos on the eye and the ear. Those are the two parts of the special senses that will be tested on both for lecture unit 3, but also lab unit 3. So you're doing double duty from here on out. Everything is very congruent between lab and lecture. To continue on from Tuesday's lecture through the central nervous system, there are wrappings around the brain and spinal cord. These are called meninges. The layer that is tightly adherent to the brain and spinal cord is called the pia mater, and that actually translated means gentle mother. Then there's a space, and then another wrapping called the arachnoid. And the arachnoid is called that because it actually, when you look at it under a microscope, it looks like it's a spider web. So that's why it's called arachnoid, like an arachnid spider, right? So up here on the picture, the arachnoid meninge is shown here with these reticular fibers that extend from it. And this space underneath the arachnoid is called the subarachnoid space. Then you're seeing this other layer called the dura mater, and that means tough mother. I am your dura mater. I'm your tough mother. And when we're talking about the dura mater going around the brain, there are places where there are two layers of it and they can separate from each other. There's a layer dura mater that is tightly adherent to the underside of the cranial bones, and that's called the periosteal layer. Then there's a part that actually follows the curvature of the brain, and where the two separate, you can get a structure called a dural venous sinus. It is a space. It behaves like it's a vein, but it's not a true vein. So we say it's a venous sinus. So it behaves like it's a vein. You see oxygen poor blood percolating through the dural venous sinuses. And we see out pockets of the arachnoid matter. These little out pockets are going to allow the subarachnoid fluid, the cerebrospinal fluid, to actually percolate out into the dural venous sinus. Those are called arachnoid villi. In your homework packet, there is a page that asks you to tell me about the stages of cerebrospinal fluid, where it's made, how it actually returns to the blood. Cerebrospinal fluid is made from the blood, from the plasma. It returns to the blood plasma. It returns through the arachnoid villi in the dural venous sinuses. So all the cerebrospinal fluid just kind of leaks back out into the bloodstream. And we'll go over that in just a moment. When people have a cranial hemorrhage, you might have heard words saying it was an epidural bleed or a subdural bleed. And they both have different clinical implications. The most common place for an epidural bleed is at the pterion. And this is a junction between the frontal bone, sphenoid bone, parietal bone, and temporal bone. So roughly right behind your eyes. That's where all those bones are converging. And that is a place where also back in this area, coming up this way near the temporal bone, you would have your middle meningeal artery. And if that ruptures, you're likely going to have an epidural bleed. That means you're going to bleed above the dural meninges. So the blood pools there, and it starts to compress on the brain tissue. Do you remember the video that I showed you on Tuesday where she had a bleed along her temporal bone? That was probably from her middle meningeal artery. And it was an epidural bleed. That's why it took so long before it compressed on her brain to the point where she started to become aware there was something wrong with her. So those take a little while before they actually start to lose consciousness. Subdural bleeds are another kind of issue where now you're bleeding below the dura meninges. You're probably bleeding out in the arachnoid space. That too can take a while before it starts to compress in the brain tissue, before the person actually starts to complain of a pain or a headache. The biggest culprit for a subdural bleed is actually being on a roller coaster, where you have a sudden turn and a jolt of your body, and your brain is soft tissue. It's kind of submerged in this fluid. So with the inertia of the movement, your body goes one way, but your brain is still going the other way. My best example of this would be at Disneyland. I'm losing the name of it. Space Mountain. Have you been on that roller coaster? It's all in the dark, right? And part of the thrill of that roller coaster is that you don't know, you can't really see unless you're really paying attention and you're in the front car. You don't really see where the tracks are going to turn suddenly. So it catches you by surprise. And I'm sure if you've been on that ride, you're holding on, and then all of a sudden there's this jolt, and the whole car is turning one way, and you feel like all the soft tissue in your body's like, we're still going this way. That is the best way that you can get a subdural bleed. And the person won't lose consciousness immediately. It might take a while, and they might complain of a headache for days before that actually presents with a clinical consideration where you need to go to the hospital, something's going on with you. So that is the more insidious of the two. You're going to be dissecting a sheep brain after spring break. And when you dissect the sheep brain, depending on when we have the sheep brains, we dissect them, but a lot of times the students will put them back into the sheep brain jars. So depending on when Professor Innens tells you to do this dissection, some of them might already be dissected for you. But if you get them fresh, you will have to cut through the dura mater, the thick meninges that you're going to have to cut through. And then you're going to separate the right and left cerebral hemisphere. And when you do that and you peel off the dura mater, the meninges, you'll actually see a part of the dura mater that's going in between the cerebral hemispheres. And that little part looks like a mohawk. And we call it the falx cerebri. It means it's going in between the cerebral hemispheres. So here's a picture of the falx cerebri. You would see a dural sinus, again, a structure that is behaving like a vein, even though it's not a true vein. There's also another place where that dura mater kind of tucks in between the lobes of a brain, in particular the cerebellum. So you have a right cerebral hemisphere and a left. And the dura mater tucks in between, sort of like you making your bed, and you tuck under your bed sheet, under the mattress, right, to keep it all contained. When that happens in between the cerebellar hemispheres, it's called the tentorium cerebelli. And again, we're going to see another vessel that is acting like a vein. Diaphragma celli, that's a fancy way of saying that there is a point where, do you remember, you learned in lab about the sella turcica. Remember, the Turkish seat. And Professor Innens probably told you that this is where the hypothalamus and pituitary are kind of hanging out. The pituitary sits in that sella turcica. Well, the meninges, the dura mater, has to tuck underneath the brain, and it goes around the hypothalamus. Has this stalk, the infundibulum. It's a part of the hypothalamus that connects to the pituitary. And where the pituitary is sitting in the sella dursica, there's a wrapping of the dura mater around that area. It's part of the blood-brain barrier. And this is called the diaphragma celli. It's just basically where we've got the dura mater hanging around the hypothalamus and pituitary gland. Falx cerebelli, tentorium cerebelli. All of these are areas where the dura mater is going around the cerebellum. Tentorium cerebelli, that's the area of the dura mater on top of the cerebellum. Going in between the lobes would be the falx cerebelli. And again, hopefully, when you return from spring break, you will be dissecting a sheep brain and you can actually see these things. Past times when I've taught the lab, I've actually labeled them, tagged them, and had them on lab unit 3. Although most other professors don't tag them. It's like they're right here, you can see them. You can actually tag them, label them, hold them in your little tweezers. They are tangible structures. Flow of the cerebrospinal fluid. This is a homework problem. The cerebrospinal fluid is made from blood plasma. The blood plasma is worked upon by the ependymal cells, one of the 4 central nervous system cells, supporting cells that I tested you on last week's quiz. So plasma goes through those ependymal cells, and then the ependymal cells will put that cerebrospinal fluid into the ventricles. You have a right and left ventricle. They are found surrounded by the right and left cerebral hemisphere. Students oftentimes say, which one's number 1? Which one's number 2? It's arbitrary. Right and left ventricle, both of them, number 1, number 2. Those are just the lateral ventricles. Fluid will seep from the lateral ventricles through the interventricular foramen into the 3rd ventricle, which is surrounded by the thalamus. On lab exam 3, be ready for a pin to be in the thalamus and a question saying what ventricle would be found within this space. So the thalamus surrounds the 3rd ventricle. Cerebrospinal fluid will continue to leak through the cerebral aqueduct. When you cut through your sheep brain in a sagittal section and you separate the 2 hemispheres, you can actually see the cerebral aqueduct, going through the midbrain. You can see it. It's a tangible structure. Then that cerebral spinal fluid is going to collect in the 4th ventricle. The 4th ventricle is bounded by, superiorly, by the pons and inferiorly by the medulla oblongata. Then cerebrospinal fluid will leak through the apertures, either through the paired lateral apertures or through the median aperture. It will go back through that subarachnoid space back into the blood flow. Cerebrospinal fluid comes from plasma and it ends into plasma. It's one full circuit it goes through. This is again in your homework packet. And I will definitely ask you on your next lecture exam for the flow of cerebrospinal fluid through these structures. Just in case you need it again, straight from your book. It goes through point by point what I just itemized on the previous slide. Speaking of the blood-brain barrier, another support cell, astrocytes, that you were quizzed on last week, they have perivascular feet. They have these extensions of their cell body, and they wrap around the blood vessels that go to and from the brain. And when they wrap around it with these perivascular feet, they create a hydrophobic lipid layer. Remember, cell membranes are made of phospholipids. So when they wrap around a blood vessel, it's like having a thick layer of phospholipids. This will regulate what can come into the brain. Coming into the brain from the blood can actually leave the blood and enter your nervous tissue. Most things cannot. The blood-brain barrier is like, it's almost sacred. You don't want things to be able to leave from your blood and enter your nervous tissue and influence that. Very few things can cross the blood-brain barrier. One thing that can cross, alcohol. Anything that is somewhat hydrophobic, and alcohol is somewhat hydrophobic. It's the same reason why when you drink alcohol on an empty stomach, why it impacts you so immediately. It can cross another barrier in your stomach. Your stomach cells have very tight junctions. They regulate what can go from the lumen, the space of your stomach, into the bloodstream. Alcohol can get through that. And that's the reason why if you drink it on an empty stomach, it gets into your blood within 20 minutes. And it can also cross the blood-brain barrier, which means within 20 minutes, your cognitive thought, your decision-making is impacted. If you drink when you have food in your stomach, it slows that absorption process. And that means you actually give your liver time to metabolize that alcohol before it's impacting your cognitive function. So it's something to be important or to be mindful of. There are places, though, where these tight junctions, this blood-brain barrier is not so strong, where it's leaky, it's permeable. One place is just below the hypothalamus. Again, where the hypothalamus is connecting to the pituitary gland. That's not the only place. There's another place near the pineal gland, and I'll explain what the pineal gland is in just a moment. The leakiness of the blood-brain barrier is actually important in some regards. For example, the hypothalamus has direct access to the plasma. The cells almost drink your plasma to survey what is in your plasma. Like, what have you ingested? What should the brain be mindful of that you have taken in? That is the reason why, for example, if you drink too much, you will vomit. It's because your hypothalamus is actually going, this is no good. It's influencing me, so I'm going to influence your behavior. You're going to puke this out. We can't afford to absorb anymore. It is also the reason why if you are spiking a fever, if you have something in your bloodstream, like an infection, a bacterial infection, a viral infection, the hypothalamus is aware of it because of this leakiness through the blood-brain barrier, and it causes you to spike a fever. There are certain ranges of a fever where it's considered to be protective, where it's an advantage for you to have a fever because your immune system becomes more heightened, more active, and you're more likely to kill off that bacterial or viral infection. A fever that is too high, though, like more than 102, is not considered to be protective. And that means something has crossed your blood-brain barrier and has taken over your hypothalamus and is now working your hypothalamus against you. So fever is something we take very seriously in a clinical setting. There are some good fevers, but there are also bad fevers. I don't test you on fevers and which ones are good and which ones are bad. You'll have to sign up for physiology to figure that one out. I do have to save some cards up my sleeve. So looking at the cerebral hemispheres, we have a longitudinal fissure that separates the right and left cerebral hemispheres. Are you right-brained? Are you left-brained? Chances are you're actually probably a combination of both. Very few of us think either in a right brain or left brain mode. You might have right brain moments, left brain moments, but most of us are a blend between our right brain and our left. Our left brain, as you heard from Tuesday's video, more logical, more linear in thinking, Right brain more connected with the life force energy as she described it. Everything around you. Can you sense when someone is upset? Caitlin seems a little off today. There's something not quite right. That's probably your right brain going, there's something not quite right. Lateral sulcus, central sulcus, sulci are the invaginations in between the gyri. Those are the bulges. So here is the precentral gyrus and postcentral gyrus, and they're separated by the central sulcus. Lateral sulcus, you can't really see it here, but the lateral sulcus is going to separate the occipital lobes from the parietal lobes. Gyri, precentral gyrus, postcentral, those are important gyri to know because they have a homunculus. Do you know what a homunculus is? Homunculus means little body, little man. It's weird to think that on your precentral gyrus and postcentral gyrus, there is this idea of a person that is along the gyrus. And the body parts of that person represent the innervation of the brain to those specific regions. So your precentral gyrus is all about your motor cortex, initiating voluntary movement. Your postcentral gyrus is all about, was it locked?
Yeah.
I swear I had locked it. Your postcentral gyrus is all about sensory, cognitive sensory input. I'll show you a picture of the homunculi. Just a moment. Your frontal lobe. Your frontal lobe, you have two of them. They are underneath the frontal bones. Your frontal lobe is all about your higher ordered thinking, your pre-planning. As soon as Kara shuts up, I'm going to go outside. I'm going to get some more lunch. In fact, I know in Kara's office suite, there's a whole bunch of leftover Mexican food from last night's science lecture series. So I'm going to go eat some of those chimichangas. I'm going to get some of the guacamole and the beans and leftover rice. I'm going to have a feast. Yeah, you better do that before everybody else gets to it. So it's all about your pre-planning. You have your premotor cortex, but also the precentral gyrus, that is your primary motor cortex. When you read in the textbook, primary something, this is a part of the brain that is primary responsible for whatever function. So primary motor means this is the area of the brain where you actually initiate motor movement, voluntary movement, initiating a motor output, action potential to skeletal muscle. If you read anything that is considered to be a pre-something, that is like a preliminary staging platform. I want to move this way, but I can't move that way. I can't go get the food until Kara stops lecturing. As soon as she's done, I'm also going to go to the bathroom. It's everything that you're sitting there right now, sitting there. You're already planning what you're about to do. After today, I'm on spring break. I'm going to start doing XYZ. That's everything to do with your premotor cortex. Every thought about how you're going to be, how you're going to move, comes from your frontal lobe. You also have an eye field, no shock, that your eyes move according to skeletal muscle that moves your eyeballs. So you're going to learn about your sex. You can think with You know what I'm thinking? Freud is rolling over in his grave. What I meant to say were 6 extraocular, hence the sex, 6 extraocular eye muscles that control how your eyes move in the orbit. Motor homunculus, that's the body, the image of a person. The size of the body part reflects how many nerves are actually controlling the movement of that particular body part. And again, I'll show you a picture of that in just a moment. Your parietal lobe. The parietal lobe, we have the postcentral gyrus. And again, we see another homunculus there. This is where your primary somatosensory cortex is. Anything where you are consciously aware of pain, temperature, touch, what kind of touch? Is it soft touch? Is it hard touch? Is it vibrating touch? All of that is now being registered by your primary somatosensory cortex on the postcentral gyrus of your parietal lobe. This is where we have conscious awareness, like I said, of touch, temperature, pain, etc. There's a special place called Wernicke's area. This is actually an area between the parietal lobe and temporal lobe. And this is where we actually start understanding speech. The right side of our brain, the Wernicke's area, the right side, again, where the parietal lobe reaches the temporal, this helps us interpret the sound of speech or the written word. You can read things and hear things where it drips with emotion. And it's different than the left side. The left side is just actually hearing the word or reading the word. How does this sound to you? Happy birthday. Olivia, it's your birthday. Happy birthday.
Happy birthday.
It's really not her birthday. But did you hear Brandon's voice?
Mm-hmm.
It dripped with more emotion than mine, didn't it? How did it sound to you? Say, happy birthday. So could you imagine if your Wernicke's area of your right temporal lobe and parietal lobe was damaged, where people were coming up to you going, oh my gosh, happy birthday, but all you heard was, happy birthday. No emotional overtone. It would be so socially awkward, wouldn't it? So you could read things, you can hear things, but you wouldn't pick up on the emotional overtones of it, or you can read it. You can read things where it brings you to tears. You can tell it's very passionate. It's very sensitive material, and you read it and you're like, oh my gosh, my heart bleeds for you. But can you imagine being a Sheldon your whole life and not picking up on that socialness, those emotional overtones?
I read a book about on psychology, and he talked about how there was a president's speech, and people in a mental institution who had brain injuries were watching it and laughing, and it wasn't funny, and it was because they could tell he was lying. But what part of your brain is that? Where it's just the emotional, but not the actual words.
So I don't know about the whole lying part, but they were clearly dissociating themselves
he was kidding.
From any emotional attachment. They were just hearing the words, and when they were just hearing the words, nothing seemed logical to them. And so because it didn't seem logical, that's how they started thinking, well, he's just talking out of his ass. Doesn't make sense. So imagine that. And have you ever heard someone the very first day of class? Do you remember? Because I remember. The very first day of class. I was picking a little bit on Amy and all of her daughters, if you remember. And I started talking about female relational aggression syndrome. It's a real thing. And ladies, we are the worst to each other. We are absolutely the worst to each other. We really are. This is the reason why I don't have a lot of female friends, because I can't handle the bullshit. I really can't. I don't have the ear for it. No, seriously. I am like a female Sheldon. I can't do it. I don't play that well with others in the sandbox when it comes to females. I'm so science oriented. That's why I get along so well with the females in this building. Math instructors, physics instructors, chemistry instructors. Why? We're mostly left brain. There is no emotional overtone when you talk about all things science and math. And I'm super happy in that regard. It drives my husband crazy. He's more of a female than I am. When it comes to, no, I mean that in a good way, not female emotional aggression syndrome. My honey is so much more emotional and connected to other people. I don't have that ear. I don't have that brain. I don't know how to talk that way. I really don't. And some of my students call me out on that shit. I feel like you're mad at me. No, I'm not mad. Trust me, this is not mad. I feel like you're no, I'm not this is just how I talk. This is just how I am. I don't know how to be lovey and feeling. I just don't. I really don't. And I don't mean any personal disrespect. It's just I'm very logical. You are not behaving logical right now. Let me get you back into reality. Oh, I feel like you're mad. I'm not mad at you. But if you keep saying I'm mad at you, I will get mad at you. So stop saying that. Let's just move on. I feel like I have a dysfunctional Wernicke area on my right lobe. I don't have that skill set. I wish I did. I really do. I would like more female friends, but I just don't have it. I don't. So here's the homunculus that I was telling you about. So I'm going to use Joyce to prey upon. If I were to take a bone saw and score around Joyce's calvaria, the very top of her skull, I could then take a chisel and a hammer and I could pry off her calvaria and take it off. It would sound like a pickle jar opening when I did that. And then I can cut through her dura mater, fillet that open, and her brain would be right there, and she could be alert, awake, and not feel any pain. The bone is innervated. I would have to give her medication for when I cut through her bone. The meninges are innervated, so I'd have to give her an anesthetic when I cut through the meninges. But once I have her brain open, if everything else I give her painkillers for, I can touch her brain and zap it and do whatever I want, and she would not feel me touching her brain. It's weird. Your brain is nothing but nervous tissue, but it's not innervated for itself. I could do this. I could cut out a part of your brain and eat it in front of you. Like in which movie? Hannibal Lecter did that, right? And remember, he had the guy alert, his brain was open, and he cut through his brain, cooked it in front of him, and ate it. I could cut out a part of your brain, and you would not feel me cut out that tissue. Does that blow your mind? It's weird, isn't it? So if I were to go to Joyce and take an electrode and zap her precentral gyrus, where her motor cortex is, when I zapped all along of it, certain parts of her body would move. I might zap a part and she goes like this. I might zap another part and she goes and sticks out her tongue. Different parts. So that's what we call somatotropy, means body mapping. That's where we get the homunculus, this little man, this body part. And the bigger the body part in the picture, the more neurons dedicated, in the case of the motor cortex, to moving that part of that. Look at your face. Look how big it is. That's why your face is so expressive. You all are sitting there, and I am reading your emotions. Some of you are not happy people right now. I don't know why. Look how big your tongue is. Just your tongue. Think about all the wonderful things you can do with your tongue. Think about how you use your tongue. How many of you have spent hours trying to pick something out of your teeth with your tongue? Like, I'm not going to cheat. I'm not going to use floss. This is a challenge. All day long, and you're like, it's a task. I want to do this. Isn't it fun? And then once you get that little kernel out, you're like, what else do I have? Let me survey it. Oh, here's another one. I guess I didn't brush that well over here. It feels a little rough. Think about your motor control of your tongue. And why? Every sound we make, we need our tongue to help us with that. Have you ever heard toddlers try and talk? Hey, Yeti, I need a yid for my Yeti bugs. If they have a speech impediment, it's probably because they are not moving their tongue in the right way. Little kids can't say their L's very well. Say L. L. Do it. L. L. Where does your tongue go? To the roof of your mouth. L. A lot of kids don't move their tongue to the roof of their mouth. That's, hey, Yeti, I need a yid for my Yeti bugs. Do you know how we help them in speech therapy so they can say their L's? We give them mints. We give them candies to suck on, because how do you suck on a candy? You put it in the roof of your mouth and you hold it there with your tongue, and you train your tongue to go to the roof of your mouth. That's how speech therapists, they work the tongue. It's all about the tongue and getting the motor memory. Postcentral gyrus also has a homunculus. This is part of the parietal lobe. Again, the body part shows you the amount of innervation. For the sensory now. If you close your eyes, and I did the following test to you, do you feel 2 points?
Mm-hmm. Do you want me to close my eyes?
You don't have to. You can't see my hands. Do you feel 2 points?
Yes.
Now?
Yes.
Now?
Yes.
Now?
I don't know. Yes.
Now?
No.
And
Yes.
what do you all see?
I wasn't even touching her.
I am touching her.
I was like, oh no.
I have 2 different points touching on her back. But because the back is such a small structure, it's not well innervated. So I'm touching her in 2 different places, but her brain is like, no, it's 1 pressure point, it's 1. But if I did the same thing to her hand, if she put her hand out and closed her hand, closed her eyes, close your eyes. 2. Mm-hmm. 2.
2. 2. 2, 1.
Look how close I am before she starts saying 1. More, sorry.
No,
Did I hurt you?
okay.
Damn, I have it on tape. I hurt a student. You have more sensory information from your hands, even from your tongue, your teeth, your face. You know, if you feel anything touching your face, aren't you like this? But there could be a spider crawling up your back and you would have no idea, but a spider crawling up your face, you would know. Look how big your genitalia are. Thank goodness they're not any bigger. If they were any bigger, we would never leave the house. We'd be grinding up against the couch. We would never leave. We would pick our clothes very differently. I think there's too much frictional rub with those jeans. I won't make it through my day. I'll be humping everything. Thank goodness they're not any bigger than they already are. They're already little sensitive creatures. Hell, the wind blows, you're like... And it's a contralateral. That means right side of the brain will control left-sided movements. Left-sided sensations are interpreted by the right side. That's the reason why we can tell where someone's having a stroke. If the stroke is happening on a certain cerebral hemisphere, it'll be the other side. And if you remember Jill Bolte-Taylor on Tuesday's video, she had a hemorrhage under her, which temporal lobe? Left. It was her left. And her right arm, she said it just went like a stump. And she used her, I had to use my hand like a stump so I could figure out what numbers I needed to call, right? So it's the opposite side. We don't have to split hairs over which side she had to hemorrhage. Okay, so temporal lobe, occipital lobe. This is where we're going to have other cortices, primary centers for interpreting or commanding movement. For these other lobes, taste, vision, smell. So vision, occipital lobe, your primary visual cortex. Have you ever hit your head so hard? You hit your head so hard you saw stars? Mm-hmm. Has that ever happened to you? So when you hit your head so hard, the pressure from hitting, the impact, that force reverberates, moves through the soft tissue of your brain. And when it hits the back of your skull, it then ricochets forward again. And when you have the force impact moving backwards, now met with the ricochet of the force moving forward, where those two hit is probably in your occipital lobe, and the stimulus to the neurons there make you think you're seeing stars, bursts of light that aren't actually there. And it's just from your primary visual cortex being stimulated from these pressure waves. That's the reason why you, quote, see stars. So vision is back here. Hearing is going to be on the temporal lobe. But that makes sense, right? Because this is where all of the sound waves enter into our head and will eventually lead to our primary auditory cortex. Insula. The insula is a part of the brain where if I took your temporal lobe and bent it down, just inside, underneath of that, that would be the insula. And that's where your gustatory cortex is, where you interpret taste. If you have brain trauma in that region, you would eat food and you would get no pleasure from it. Could you imagine drinking curdled milk and not knowing that it was spoiled? Yeah, everyone's like, ugh. Imagine just drinking that and getting no taste feedback. You would probably get other sensory feedback, like the way it feels in your mouth. The fact that it's now feeling like cottage cheese instead of milk would probably be a big clue that it's not okay. But could you imagine? And have you ever done that? Have you ever taken a gulp of milk without smelling it? And you take a big drink, you get it to the back of your throat, and then it finally is being processed by your gustatory cortex like, you don't want this. You should probably spit this out right now. You make that mistake one time in your life, don't you? After that, who doesn't in this room opens the refrigerator, grabbing the milk? Who doesn't open the lid and immediately do this? Don't you do that every single time now? Because you don't? You should.
I read the back.
It's not the date, because I'm here to tell you, give it a warm summer and your refrigerator is working too hard and not quite keeping things as cool as you think it's keeping it. The date might not have reached the expiration date. You should still undo. I'm telling you, if even the neck of the milk bottle doesn't smell right, I don't care. The whole thing is down the sink. If even the milk could be fine, it's just the outside. I'm like, nope, we're done.
Whole milk, the whole gallon you throw it away.
Goodbye.
My
Goodbye.
dad will still tell me like drink it, like doesn't matter.
So you have clearly had such a good life. You've never consumed bad milk.
No, I have like multiple times.
It's like, no, it's a cost thing, Kara.
I give up, like try drinking milk. No.
So you don't drink milk anymore.
No, stop. I know it's like expired.
So in your homework packet, I asked you to know about the different cortices. That means different parts of your brain are responsible for interpreting different sensations or initiating certain kinds of movement. Do not, if you are reading your book, good for you. But if you are reading the CNS chapters, especially the brain, not so much the spinal cord, there are a lot of associative cortices, associative cortex. Do not spend too much time on the associative cortices. The only ones I told you about were like Wernicke's area, and there's also Broca's area. Broca's area is all about initiating speech and also having your speech have emotional overtone. So what if you couldn't be, Alex, I'm so proud of you. You passed your lab exam. Imagine if that just came out, Alex, I'm so proud of you. You passed your lab exam. You'd be like, I don't really have a vote of confidence that you give a shit about me.
Associative.
There are areas of white matter and gray matter in your brain. White matter is all about myelination. What's myelinated? Axons. So there's a corpus callosum. This is the connection between your right and left cerebral hemisphere to allow communication between your right side and your left side. Your right side is all about emotion and feeling for the most part. Left side is all about logical thought. And I want bananas for my cereal tomorrow, so I should stop at the store on my way home from class tonight. I got to get my bananas. Or I'm out of dryer sheets. I like my clothes soft. When I am done drying them, I want them to be soft. I need fabric softener. So it's all about calculation. Right side, more about emotional overtone. And none of us are really, in this classroom, right side or left side. We are a blend of both. I like to say we have right-sided moments, left-sided moments. I have more left-sided moments than right-sided. I'm definitely left-dominant, but I'm not left-brain person. I still have right-sided emotional moments. I have zero creativity most of the time, but I have moments where all of a sudden I have this burst of creativity, and I actually think, hey, maybe I should scrapbook. And then I go to Michael's and I buy $2,000 worth of scrapbooking materials, thinking, oh, I'm going to do this. And then my right-sided moment is gone. And I'm left with all these materials. And then I don't do anything. They're all in the cabinet. I have $2,000 worth of scrapbooking shit. And I have all the pictures. I have all the pictures organized. But it will never, it will never get put in a book.
Put it all the time.
It just will not happen. You come to my house, decoration, here, me, home decorating, here's what my left side says. You have to clean that shit. So my right side brain goes, wouldn't it be nice to make the house look soft and inviting and warming and have pictures and pillows and blankets? And my left side is like, yeah, then you have to clean that stuff. Less knickknacks. Fewer knickknacks you have, less dusting you have. So I have shelves, nothing on them, because then that means I have to move that shit to dust. That's how my brain works. My left brain is like, keep it simple, stupid, keep it simple.
So, you know how like abundance is different from robots' emotions, and that's something that maybe we haven't been able to like come up with.
Yeah.
Yeah. So is that all like going back to like the right side of the brain?
So I'll follow Niku's comment with another issue. Recently, we've had some planes crash. The Supermax 737 has had 2 accidents within a couple months of each other. Lots of people killed. And apparently, it's because people did not download the software upgrade. Does that blow your mind? How many times does your phone tell you you need to shut down the phone and reboot so that you can get your upgrade? And your computer. Like at least once a week, right? Now imagine doing that for a plane, because they have the same thing. So apparently, no one did the software upgrade, and we have pilots that are trusting a computer system because that has to be better than me. I'm a human. The computer will know. And so when the plane is approaching a landing, for example, and the pilot knows intuitively, hey, we should have a faster speed for this approach, and the plane is too slow, they're trusting the computer and not overriding. And we're having more accidents now. Self-driving cars. When I drive a car, and my kids, anybody's kid, if anyone's child is in the car, they're in the back, they're not in the front. And depending on how many kids I have in the car, I actually tell them where I want them to sit. Did you even think of that? If it's just me and McLean, I make McLean, he wants to sit right behind me. That's his usual seat, because his brother always sits on the right side. So Mac naturally wants to sit right behind the driver. That's where he's always sat. But when it's just me and Mac, I will make him sit behind the passenger seat in the middle row of the car. And here's why. If I have the opportunity, if I see that I'm going to be in an accident, if I have even a split second of time to make a decision, I'm going to turn the car so that I get the impact and he won't. I will do that. Where's the software that will make that decision? I don't see it yet. That's new territory for us. What computer software system will take into consideration how a parent will behave? Have you ever come to a curb and you want to turn right and someone's standing on the curb? Have you ever seen someone standing on the curb where they might not have the best mental capacity? and you can't tell if they're going to step off or not? You're not really sure? I'm sorry. Cars in park, we're waiting. Green light says I can go, but I don't have to. I'm waiting to see what this person's going to do. No, none of us are moving until I see what this person's doing. I don't see the computer software doing that. Not too long ago, a Tesla driver got into the car, put on the autopilot, basically for the Tesla, the auto navigation, auto driving, passed out in the front seat, drunk, car driving them home. Everything's fine. Cop driving along the lane next to him sees this person, no one in the driver's seat, sees the person in the passenger seat slumped over. Cop knows car is doing the driving, but this passenger clearly is not with it because you're still responsible for your car. You do understand that. Cop realizes this guy, and the cop is got the sirens and lights on. The guy is so inebriated he doesn't wake up. Cop calls for backup. Clever. Between the two cops, one got behind the car and did a traffic break. You've seen that, right? Where they start stopping everyone. The other cop got ahead of the Tesla, knowing that the Tesla would respond to any change in speed. The cop started slowing down speed. So this motorcycle cop starts to slow down his speed, and the Tesla car behind it just started slowing down, and they got it to a complete stop. No one hurt. Now, that's not a computer thinking. That's a human being thinking. There's so many instances. I don't care how good our software is. There will be those je ne sais quoi moments. Do you know what that means?
I do not.
Je ne sais quoi is French for I don't know. Je ne sais quoi moments where you can't program that into a computer. There's just no way. I don't care how good our AI gets, our artificial intelligence, there will still be some je ne sais quoi where it won't be able to make the same decision you and I would make. Okay, so going back, corpus callosum, there are also projection tracts, association tracts. Do not memorize. There's like 3 or 4 pages in your book that talks about these projection tracts and association tracts. I don't care. I don't care. I'm not saying they're not important. All it is the ability for one lobe to communicate to the next lobe. Hey, this is what we're feeling. This is what we're sending for output command. Can you make that happen? You have to have the different lobes communicate to each other. Corpus striatum. Striatum means lined, striated lines. Corpus striatum, there are different parts to it, caudate and lentiform nucleus, and then the lentiform nucleus is broken down to even 2 more smaller parts, the putamen and globus pallidus. So first of all, where is the corpus striatum? Right here. It is a series of gray matter right here in the lateral cerebral hemispheres. Gray matter means we're talking about neuronal cell bodies, centers that are responsible for something. And the corpus striatum is all about, and old textbooks used to call these the basal ganglia. Well, ganglia is a term to refer to neuronal cell bodies outside of the central nervous system. So to call them the basal ganglia is not okay. Basal nuclei would be closer. This is all part of the corpus striatum. So here's the caudate, and then we have the lentiform, and then again the lentiform is broken into 2 smaller parts. And why do you worry about the corpus striatum? It's all about initiating movement, initiating voluntary movement. And this is where we can have a breakdown. If you lose function of your corpus striatum, then you cannot regulate your movement. You cannot regulate the initiation of movement, the cessation of movement, the intensity of your movement. Could you imagine if you walked, every time you walked like this? People would see you coming like, wow, that's an intense person right now. But what if that was just your everyday? Getting up in the morning. Breakfast! So regulating how we move, the intensity with how we move, that all comes down to your corpus striatum. Even expressing your moods. That's a funny comic strip. Can you imagine if I did that every time? You did so well. Look at, she's terrified. It's not right. You'd look at that person going, you're not right. Something's going on with you. That's not a normal reaction. It's terrifying. So people with disruption in their corpus striatum, they have movement that seems severe or not enough. Like, I can't tell you how many times in the morning when I have to get my teenager up in the morning to study early, this is me. With purpose, McLean, with purpose! Because he's tired and he's 15 and he's a teenager and he's like, I gotta get the sleep out of my eyes and get into the shower. And here I am. I've been up since 5, a whole pot of coffee, just add the cream to it. And I'm like, with purpose, let's go, we gotta study. He's like, I'm just so tired. Oh. Imagine being like that every day. I'm just so tired. That's not normal either. Moving also is complicated because when we think about not just initiating and stopping, but regulation, we want to regulate our movement. It's a little weird, isn't it? I know. But we also, when we move, we don't want antagonistic. You learned about muscles already. If I want to do a biceps curl, I flex the forearm. What muscle should be inhibited then? Triceps brachii. It's antagonistic. So if I want a certain movement, I have to also inhibit any antagonistic muscle group that I don't want to contract because in lecture unit 2, I did teach you about skeletal muscle contraction. What is the neurotransmitter released on skeletal muscle to get it to get an action potential? Did I ever teach you any other neurotransmitter that is released to make the muscle relaxed? I never taught you. I never taught you any other neurotransmitter. I said we need to know what do we need to get a muscle to stop contracting. Do you remember? That was part of your essay. Acetylcholinesterase, the neuron to stop firing, remember? Calcium to be sequestered. Do you remember all of that?
Yeah.
Never did you say an inhibitory neurotransmitter needs to be released on skeletal muscle. Never, because there is no such thing. So if you want muscle to relax that's antagonistic, then that means a neuron that's synapsing on the motor neuron to the triceps brachii is now releasing neurotransmitter on that neuron that hyperpolarizes it. Remember, move me. Make me more negative. I'm further away from threshold, aren't I? Then that means that somatic motor neuron will likely not fire. That's the only way you block unwanted movement. If you lose the neurons from the brain, the interneurons releasing inhibitory neurotransmitter on a somatic motor neuron, if you lose that, then all they get are excitatory signals, and you will now have antagonistic muscles working at the same time, and you will look like this. What disease state is that? Where you have dyskinesia like that, that means bad movement. Who moves like that? Parkinson's disease. They've lost their inhibitory action potentials. It's a different part of the brain than what I'm talking about now, but it's connected to this corpus striatum. It's a part of their midbrain that they've lost. They can't stop unwanted movement. If you can't stop unwanted movement, then what do you get? Unwanted movement. And your facial expression will even show that. That's why a lot of times people with Parkinson's disease don't want to go out in public, because they feel like everyone's looking at me. Yeah, because their facial expression is all wrong. Don't like that shirt that she's wearing. I probably shouldn't show that, right? Imagine if I couldn't stop that from happening, where I'm like, it's a bad wardrobe choice. If you don't want that movement and you can't block it, you're gonna get the movement you don't want. And that's socially awkward. Not just for walking, but also talking, facial expression. That's why people with Parkinson's disease, they have a whole level of depression. Because they know that people are looking at them and they're not behaving right. Their facial, they say they feel like they're wearing a mask. So awful for them. Another part of the brain, the diencephalon. If you remember from Tuesday, I told you about the embryonic origins, like the balloon artist. The diencephalon is all about the thalami, the epithalamus, the thalamus, and the hypothalamus. The one part of the epithalamus that I want you to know is the pineal gland. This helps with your day-night circadian rhythms. The pineal gland is so cute. Oh my gosh, it's darling. When you dissect it in the sheep brain, and Professor Innen shows you the pineal gland, it's this cute little stump. It's a little stump. It's just, you just sit there and you just want to flick it. It's just so cute. And this is where you get melatonin, a hormone that helps with your day-night circulation, or circadian rhythms, I should say, circulating from day to night rhythms. Right now, all of us have a problem with our pineal gland, don't we? What just happened last weekend? Time change. Takes you 2 weeks to get your circadian rhythm back. 2 weeks. So if you feel tired and you just can't get ahead of anything, bad timing for a lab exam, don't you think? Bad timing. I think you should go to Professor Innens and say, I think I had an unfair disadvantage because of the time change. You probably don't want to do that. I fear for what she will tell you. But it's going to take us 2 weeks to reset our circadian rhythm. It's so important for you, for your pineal gland, to have a regular rhythm. And when you're students, you had this idea, I can if I stay up late and study, I'll do better. No, you will not. The studies have been done. Stop doing that. Stop doing that. You're just like a 3-year-old. You're just like a 3-year-old. You need a regular bedtime. And you need a regular time to wake up. You need to be regular in your sleep and day cycles. But as adults, you're like, no, I can do it. Oh, I'll catch up on the weekend. Actually, you can. You can actually catch up on lost sleep. That studies have been done. You can, but it still doesn't feel good, does it? You feel like you're still off. Like I need to pull my head out of my ass. I need to get in my groove again. You need to be regular. It's your pineal gland has clues. They're called Zeitgebers. Do you know what that is? Zeitgeber. What is your most important Zeitgeber for your day-night rhythm? Light. The actual light. So in the morning when you wake up, you need bright light on your eyes, hitting your retina, because it goes straight back to the hypothalamus, which is important for day-night circadian rhythms, and then also back to the pineal gland. You need that. Do not put on your sunglasses. You need the phototherapy. You need that. In fact, they sell lights for people who live in Alaska or Canada, where the day-night cycles are so wacky, where they don't get enough sunlight. They have light boxes where you put them on, turn them on in the morning, and you just stare at this light box, and it's giving the phototherapy to the back of your brain. You need that, and you need to be consistent with it. It's called sleep hygiene, and that doesn't mean, Brandon, that we take a shower before we go to bed. If you do it right, it takes about 2 hours for you to get ready to go to bed. 2 hours for your body to go, yes, it's called entrainment. You need to entrain your mind. We are now slowing down. I'm getting ready for bed. Now's not the time to look on my laptop. Now's not the time to start playing on my phone. No, I am starting to wind down. I don't care what's happening. Light up my phone. Phone should be in a drawer somewhere. Those LED lights, do you have an LED light in your light switch where when the lights are off, in an emergency, you know where your light switch is because you can see it across the room? Even those are bad for you. Even that little bit of light, even when your eyes are closed, is getting to your brain, and your brain's like, I'm confused. I'm getting light, and I know we're supposed to be sleeping right now. Isn't that weird? It's all about the pineal gland and the diencephalon. The hypothalamus is about the size of an almond, and in that tiny little space we have so many different nuclei. Remember, a nucleus is a collection of neuronal cell bodies that have a common function. And this little tiny spot of your brain is also important for day-night circadian rhythms. It also controls your feeding behavior, rage, sex behavior. Everything about you on a primordial scale comes down to your hypothalamus, regulates your body temperature too. Such an important little tiny part of your brain, and it affects so much. It is in direct communication with your pituitary. Your pituitary gland, there are two parts of it. There's anterior and posterior. They came from different embryonic origins. They did. Your anterior pituitary actually came from the back of your throat when you were an embryo. Came from the back of your throat, rose superiorly, ended up in the infundibulum, and then part of the hypothalamus grew inferiorly, and the two parts ended up growing together in the sella turcica. Posterior pituitary is actually an extension of the hypothalamus. I hate that we call it the posterior pituitary. We should just call it the tail of the hypothalamus because it's still part of the hypothalamus. Anterior pituitary came from your throat. Anterior pituitary makes, stores, and releases 7 different hormones. Posterior pituitary doesn't make any hormones, just stores them and releases them, but doesn't make them. They're actually made by the hypothalamus. And you'll learn more about these two structures when we get to our endocrine system. That will blow your mind. Hormones. How do you make a hormone? Do you know how to make a hormone? Don't pay her. Think about that. It's taking some of you a little bit too long to get that. Epithalamus, the only part of it, like I said, is the pineal gland. Very important for your circadian rhythms. Melatonin is a hormone and it helps with your circadian rhythms. If you travel and you're crossing time zones, melatonin is not your friend. So if you actually are taking a flight to England, let's say, you actually select your flight, you'll notice that they have flights leaving at a certain time of day. And the idea is that you'll end up in England when they're actually starting their day. And then when you come back over here, you'll end up where the day is ending. So there's visual clues to your brain like, oh no, I feel like I should be sleeping. No, but the sun's coming up. I need to go, go, go. So if you take these transatlantic flights, a good airline carrier will actually time the flights where you're either showing up at a time of the day where you should be awake or going to bed. One of the two. Very rarely will they give you an option of in between. And it's to help you to adjust to the new time zone. Melatonin can help you with that. You can buy that at a vitamin store like GNC. Melatonin, if you use it as a sleep aid, and you can, you should take it about an hour before bedtime. Do not take it at any other time. If you are not inclined to get into bed within an hour, then you do not take your melatonin. If you take your melatonin, that is a signal to your brain of we're shutting things down. You don't need a lot of melatonin for you to start feeling sleepy. Now we're moving down inferiorly to the brainstem. We're going to the midbrain, the mesencephalon. The midbrain has two structures that you're going to see on your sheep brain. Collectively, they are called the corpora quadrigemini. Corpora, body, quadrigemini, four bodies. 1, 2, 3, 4. There are two superior and two inferior. The two superior is superior colliculi, two bottom inferior colliculi. The superior colliculi, your eyes respond to the superior colliculi. They track. It will cause your eyes to track something in the distance that your brain, some other part of your brain going, something's not quite right with what's going on over there. I like to think that my honey has an overactive superior colliculi. I'll be at a restaurant with him, talking to him. I think I have eye contact with him. And next thing I know, his eyes are somewhere over here, looking. And I'll stop and say, if I turn around, will I see some sort of hot chick? Is that what you're tracking? And he'll say, what? Wait, what? What was I doing? And he doesn't even know. It's his superior colliculi. That's a real thing. So guys, there's your out. You're welcome. You're welcome.
Say that one more time, please.
Superior, honey, it's my superior colliculi. I thought there was something threatening over there. My brain was distracting my eyes. I had no conscious control over it. That's true. There's something threatening over here. And then your honey will be like, damn right, you keep looking over there, there will be a threat. So if you get caught with your eyes meandering and you don't even realize it, and someone's like, over here, you can go, damn superior colliculi of my corpora quadrigemina. And then who can argue with that? How many people know about that? You're welcome. Now, your inferior colliculus, those are wired to your ears. Your inferior colliculus wired to your ears, and that means that thank you. When you hear a loud sound, your head turns to that loud sound. You can't help it. So any sort of commotion your head naturally, your ears, like you're like, yeah. Because if that's a bus coming through the wall, I should probably get a visual and auditory signal on that so I know where to run away from it. So anything loud, threatening sound, your inferior colliculi, so your eyes are superior to your ears, yes? Superior colliculi, meandering eyes. Sorry, honey. Inferior colliculi, linked to your ears, anything threatening, I gotta turn, because if I turn, I get all the sound better into my pinna, and I also get a visual. Now I can see the loud, threatening sound. It's important to me for my survival. That's what they do. Isn't this cool stuff to learn about the brain? Now when Professor Innens, when you come back from spring break, and you're going through the sheep brain, she's gonna point all this out on the brain. She's gonna say, this is the midbrain, this is the lateral ventricle, this is the cerebral hemispheres. And then on lab exam 3, you're expected to know what function these parts of the brain have. So you're getting the function now. She will point out the actual structures, but you're expected to blend all of these together. Substantia nigra and also the red nucleus. So substantia nigra means black substance. That's these common looking structures. The red nucleus, all of these are part of the midbrain. The red nucleus is important for hand-eye coordination. Little kids, for example, when they're learning to tie their shoes, that's like actually a state standard before they go from preschool to kindergarten. They're expected to know how to tie their shoes. All the parents in this room they're like, yeah. And you gotta practice that shit with them. And that whole, do we have them do the rabbit ears and then we do it this way, or do we do the little around and loop and pull? But their red nucleus is not developed well enough for that, and that's why some of them have to actually practice over and over to learn how to tie their shoes. How many of you know how to tie your shoes? I actually have some students that don't know how to tie shoes. They're tied?
Takes me a few times.
I've had to tie shoes for some of my adult learners because they're walking around with their shoelace undone. I'm like, your shoe's untied. And they're like, yep. Tie the fucking thing. I don't know how. Are you kidding me? Put your foot up here. Let me tie. And just today, I was playing Words with Friends, and I don't have the ad free. So I get all the ads in between every play. And one of the ads was for shoelaces, where you actually poke them through the holes, and they keep your shoe tied, even though there's nothing to tie. It's like, wow, there goes the red nuclei for so many millions of people right now. Substantia nigra, black substance, that's the part of the brain that starts to die in people with Parkinson's disease. Those neurons release a neurotransmitter called dopamine. And when you lose your dopamine from this area, you lose the ability to inhibit unwanted movement. So if you can't inhibit unwanted movement, what will you get? Unwanted movement. And it's this part of the brain that's actually deteriorating. If you want to watch a cool video over the break, you don't have to. It's called The Case of the Frozen Addicts. The Case of the Frozen Addicts. It's an old PBS special. So this is back before HD TV. So the sound quality and the video quality is craptacular. Back from the 80s and 90s type thing. And it chronicles some drug addicts that were trying to actually get off on meth. And they bought their meth from a street drug vendor. And this drug vendor had his own meth lab in his home. Cops were on to him. They could never capture him, though. They knew he was a meth dealer and had his own meth lab because I had already blown up one of his homes from a bad meth experiment. And one doctor ended up getting a patient in the emergency room that had locked-in syndrome, couldn't move voluntarily, could blink their eyes. And through questions like blink twice for yes, blink once for no, was able to figure out that this was a drug user and meth was their preference. Couldn't figure out why they had this locked-in syndrome. Weird. This doctor, ends up getting invited to a cocktail party like in Central California. Ends up at this cocktail party talking to another doctor from Southern California. They started talking, and the doctor said, let me tell you about this weird case I had. And the other doctor said, no way, I did too. And they started comparing notes only to find out through a lot of investigation that these two different patients got the same bad drug batch from the same drug dealer. And it was killing their black substance, their substantia nigra. And they were presenting with acute Parkinson's disease. And that was the first time we were able to get a molecular handle on what actually causes Parkinson's disease in the inherited form that we read about. It was because from those meth users. It's an amazing, the case of the frozen addicts. I can't do it justice. It's worth an hour. It is a documentary kind of info, but if you want to get a glimpse of how we started learning about Parkinson's disease, that was it for meth addicts. They eventually end up catching that drug dealer, but not because of actually selling the drugs. They caught him on tax evasion. There's a point where the doctors and the police were actually being antagonistic against each other because the police wanted to get the bad guy and the doctors wanted to get the bad guy but not to incarcerate. They wanted the bad guy to say, show us your meth lab, something's going on, we got to figure this out for the sake of our patients. So it was this cat and dog chase between the cops and the doctors with this guy, doctors wanting to help the patients and get them out of this locked-in syndrome. And many of them did recover. Some of them had to go to Europe to get stem cell therapy. And then the cops just wanted to catch the bad guy. They be damned what he was making. We just want to get the bad guy for making the drugs. So eventually they were able to work together. But it's a very cool story. You're going to learn about your cranial nerves. Cranial nerves are numbered 1 through 12. We use Roman numerals. Do you know your Roman numerals? So cranial nerve 3 and 4 are going to come off of the midbrain. You'll learn more about cranial nerves when you come back from spring break. Now we're moving inferiorly to the pons. Pons, I think, pillow, peeing, and pons, like all the P's. Pillow, peeing, pons. Pons is important for helping with your sleep cycle, going through the stages of sleep. Pons is also important for your respiratory. It's not the primary region for regulating respiratory. The medulla oblongata is, but the pons can influence. It's also important for micturition, that means peeing, relaxing your bladder sphincter muscles so that you can pee. Cranial nerves 5 through 8 come off of this region up here. Again, you'll learn about your cranial nerves. But those cranial nerves are going to be very important for taste, for sensations on your face, producing excretions like saliva and tears. Also equilibrium, rotational analysis. Have you ever been on a roller coaster? Get off the roller coaster, do you still feel like everything's spinning? Or you've consumed too much alcohol and you feel like everything's spinning, right? And you want to close your eyes and pass out from the alcohol, but when you do that, you feel like you're spinning. So you open your eyes so you have a visual, like, I'm going to just look right there. And that way I know I'm not spinning. You have cranial nerve number 8 to think for that sensation. Medulla oblongata, the rest of the cranial nerves come from there. There are structures called pyramids. The importance of the pyramids, these elevated regions shown here, these elevated bumps, that's where we have decussation, that's where crossing over occurs. You heard me say that any right-sided sensation is interpreted by the left side of the brain. Any movement for the right side is initiated by the left brain. Well, that crossing over, that's called decussation, that happens in the medulla oblongata. That's where left commands go to the right side of the body. Right sensations cross over to the left side of the brain. The fourth ventricle, as you heard me say, is bounded superiorly by the pons and inferiorly by the medulla oblongata. Cerebellum, when you cut through that on your sheep brain, you will see that it has the arbor vitae. Arbor vitae means tree of life. Doesn't this look like a tree with branches coming off? So it's white matter, axons that are myelinated. It branches out, and you see all of these little folds. Those are called folia, like foliage, leaves on a branch. So the cerebellum is all about the arbor vitae and leaves on top of it. There are fissures, that means invaginations. For example, right here, there's a fissure in between here. And this, the vermis, vermis means worm. Who knew that you had a worm in your brain? But you have a vermis, that means worm. So Mom, Dad, I've got a worm in my brain. Reticular formation, when you read about that in your textbook, reticular formation is not a distinct structure. Reticular formation is actually, we're now sharing lots of different parts of the brain, different parts that collectively work to help you be alert, to be awake and alert. For example, when my dad was alive and I'd be studying for an exam, I'd be upstairs in my room and I'd be playing my music. How many of you study with music on? Okay. My dad would come in, turn off my music and say, turn off that narcotic shit that you're listening to. You need to study. And I would say to him, no, the music's helping me study, Dad. It's keeping me focused. No, it's distraction. Actually, I wish I knew about the reticular formation back when I was a teenager, because I would say, you're wrong. The reticular formation, when you play music, it actually is keeping your brain alert so you can stay focused on your task. The reticular formation drowns out the music, so you're not really paying attention to it, but the sound and the regularity of the rhythm keeps your brain alert. It's the same kind of thinking if you go to study at Starbucks. So back when Hayden, my oldest, was in high school, he was struggling in math. And he and I, we were doing the whole parent-child thing, and I was yelling at him. That wasn't helping. And I'm the math and science person, so that was my job to help him and study. And I was losing my mind with him. One day I'm coming home from work, and I say to him, I call him, say, you better have your book bag packed. I want your book, I want your calculator, I want paper, I want a ruler, and have your ass ready. When I pull up in the driveway, I want your butt in the car. So I pull up, he comes running out. He's like a sophomore in high school at this point. He gets in the car, and he is this close to crying because we're already fighting. He's got a big math test. Mom, are you going to take me to your school? I don't want to go to one of the math teachers. I'm going to be embarrassed. Hayden, shut up. It's a very harsh house. You think I'm mean to you all? No. Be one of my kids. Mom, I don't want to go. We'll work hard. Hayden, let's get some dinner before we go. Where do you want to go? I don't care. You pick. No, you tell me. Where do you want to go? Do you want Jack in the Box? Do you want McDonald's? Subway? Fresca, where do you want to go? McDonald's. And he's just like this in the car. Driving real mad. I get to McDonald's. Get out of the car. I scream at him. Get out of the car, grab your book bag, let's go. And he grabs his book bag and he's very confused. He's like, what are we doing? I said, we're studying here. We're not going to Saddleback. We're studying here. I just completely changed my voice. And he was confused. We're studying here? I said, yeah. And I walked him into McDonald's. And I said, you see? Look, there's a dad over there studying with his daughter. You see that Golden West College student? They're studying over there. I said, Hayden, look at this place. It's well lit. We have food. We have a bathroom. And it's public, so mommy can't yell at you. And it's true, though. I couldn't. And so it made me mellow out, knowing that others were around. It made him mellow out, knowing that he had food, he had a bathroom, and we were there for like 5 hours. We got through every problem. We didn't argue, because I couldn't yell at him. We got through it. It was a total game changer. It was all because of the reticular formation. Very busy, loud place, but we were able to stay to task. He didn't get sleepy. And that was part of me yelling at him at home. He'd be sitting there at the table with me, and he'd get sleepy. I'm, come on, with purpose, answer that problem, let's go! So if I took him to McDonald's, reticular formation stimulated, he was able to stick to task. All of his bodily functions were taken care of. You want some more food? Go up there and get more food. You have to go big potty? There's a bathroom over there, go. Total game changer. Turned it around for him. So that whole idea of, no, I need music to study, that's a real thing. You're welcome. Now you can tell your parents, it's my reticular formation. I need to feed my reticular formation. I need stimuli. That's a real thing. People who have a dysfunctional reticular formation from brain trauma, oftentimes when they're in the coma and they don't awaken from the coma, it's because their reticular formation centers are dysfunctional and not communicating with each other. Another system, limbic system, again, not a distinct structure, but rather we're sharing from different parts of the brain. Your limbic system is your emotional brain. Your limbic system has structures like the hippocampus. Hippocampus, right here. Hippocampus means seahorse. Who knew you had a seahorse and a worm in your brain? And amygdala. Amygdala means almond, and an almond in your brain. Now you're going to go home and say, I have a worm, a seahorse, and an almond in my brain. And the amygdala and the hippocampus, they're all part of the limbic system. And how they're important with emotion is that they are your emotional memory. Your emotional memory, your emotional baggage. For example, Mac has been stung by bees and has had a progressively worsened allergic reaction to them, to the point where he had to get an epinephrine, different epi, because he was going into anaphylactic shock. The child will not get out of the car if I drive to Armstrong Nursery to buy some flowers or herbs or something, because why? There are flowers and there are bees. He will not. That is his limbic system going, you. I don't want to go to the doctor. I don't want to repeat that. That's your emotional baggage regulating how you behave. Some of my students can make the sound with their fingers by rubbing their fingers, and it sounds like a bee. And one of my students did that. When Matt came to class one time, they made this sound where it sounded like a bee. He freaked out. That was his limbic system going, I hear a bee. What comes next? I'll be stung. What comes after that? Hospital. So how do you behave when you hear or see something that's your trigger point? Are you rational? Are you irrational? Are you afraid of heights? Do you have some sort of fear where you react a certain way where other people are like, you need to chill out? That's your limbic system freaking out on you. It is pulling from past memories, and most of our memories are made from bad ones, bad circumstances, where your brain is like, we never want to be in that situation ever again. Avoid, avoid, avoid. So it's your avoidance behavior that your limbic system is very much in charge of. And I'm sure if I asked you all to share some really bad memory that dictates your behavior to this day, that's your emotional baggage. We all have mental health issues. I like to say, do you know you're crazy? What's your crazy? What part of your past is your limbic system going, we never want to do that again? And the cingulate gyrus is another part of the limbic system. I like to think that I have an overactive cingulate gyrus because I like to express myself with dramatic movement. That's my cingulate gyrus. Now we're getting to the spinal column. You have 31 pairs of nerves. You have 8 cervical, 12 thoracic, 5 lumbar. We have then sacral, 1 through 5, and a pair of coccygeal nerves. Coccygeal by the coccyx, your tailbone. There are parts of the spinal cord where they get enlarged in width. We see that in the cervical region, and we also see it in the lumbar region. Any thoughts why? Cervical region and upper thoracic region innervating the upper member. So we need a lot of nerves going to that region. Lumbar region going to the lower member. Cauda equina. Cauda equina. No? Lion King? Hakuna Matata. I go, Cauda equina. Means horse's tail. Who knew you had a horse's tail in your body? So you got a worm, a seahorse, an almond, and a horse's tail. Cauda equina is actually after the spinal cord ends, which is around L1. That's way up here. Anything traveling in the vertebral column after that is just a whole bunch of nerves. And it looks like a horse's tail, like you making a ponytail. So from now on, ladies, when you put your hair back in a ponytail, you have to say, I'm going to the gym, so I need my cauda equina. I need my horse's tail. Got to put my hair in a cauda equina. So the enlargements, I covered that. Conus medullaris, that's where the spinal cord actually ends, around L1. Fissure and sulcus, these are invaginations in the spinal cord. I need to show you a transverse section of that. So here we see these invaginations, ventral, sorry, this is dorsal, this is ventral. We see white matter in the spinal cord. We also see dark matter. The dark matter is not called nuclei like we saw in the brain. It's called horns. So there's dorsal gray horn, a ventral gray horn, and around the spinal cord we have the same meninges that we learned earlier around the brain. So we have dura mater, we have arachnoid, and we have pia mater. If someone is getting an epidural, we actually go in between the vertebrae. We go below L1 because that's where the spinal cord ends. If I put in this needle to either collect cerebrospinal fluid or actually to inject anesthesia, I don't run a risk of piercing the spinal cord because there is no spinal cord, just nerves. And the nerves, even though the nerves are there, they're in fluid. So if I insert a needle, do you see how my hair just moves around my finger? I'm not actually piercing a hair, am I? They just move out of the way. So that's why it's safe to actually inject anesthesia or pulls cerebrospinal fluid from this region. Brain matter, I told you. Rami means branch. Central canal is where cerebrospinal fluid percolates through. We have roots. We're going to learn more about that when you come back from spring break. We have a posterior root. We have an anterior root. They're also called rami. So posterior ramus, anterior ramus, the meninges, dura mater, arachnoid, tightly adherent would be the pia mater. Rootlets, those are these tiny little structures coming off of the roots. We'll learn more about that again when you come back, right? This is a transverse section. More on this to come after the break. Gray matter, we'll go through that in detail. There will be columns or funiculi. This means tracks, basically, that are sending sensory information up to the brain for a higher processing, or motor output commands coming down from the brain out to the different levels of the spinal cord to control movement of your upper member or lower member. And when you come back from the break, we're going to start learning about all of our neural pathways: ascending, descending, sensory incoming, motor output. We're going to be drawing a whole bunch of pathways, won't we? It's Antoinette's favorite time of the semester in that regard.
Yours too.
I know. It makes my nipples hard. I like it. Bye.
Yeah, seriously, went to every